Welcome to Boston Community Health. I'm Dr. Elias Vaughn. Many individuals assume massage merely relieves muscle fatigue, but geriatric medicine clinically proves that stimulating delicate capillaries around your neck and scalp each morning releases vital nitric oxide, dilates vessels, and effectively halts silent strokes. Today, I will demonstrate a precise 6-step microvascular massage protocol designed to activate your parasympathetic nervous system right at home. When navigating past age 40, the progressive accumulation of atherosclerotic plaques inside your carotid pathways operates exactly like a hidden bottleneck, silently restricting vital oxygen-rich blood flow toward your brain cells. The primary and most critical movement within our diagnostic routine is the clinical vertical stroking of lateral neck segments. Utilizing your soft fingertips, place them gently underneath the jaw angle and stroke smoothly downward toward your clavicle bone rhythmically. The definitive clinical boundary here requires that you never apply deep compression or press hard inside the anterior cervical triangle, which houses the sensitive carotid sinus. Applying this gentle, controlled mechanical pressure efficiently triggers neurological baroreceptors, signaling your central nervous system to rapidly lower systemic blood pressure, smoothing endothelial stress and allowing fluid oxygen circulation toward your cerebral cortex. Movement number 2 isolates the mastoid bone zone located directly behind your earlobes. This anatomical sector serves as a primary junction for numerous microvessels and cranial nerves regulating baseline vascular tone. Use your thumb and index finger to apply gentle circular frictions around this mastoid region for 2 full minutes every single morning. This clinical mechanical stimulation effectively triggers the natural release of gas nitric oxide molecules from your endothelial lining, inducing direct microvascular dilation. This timely lifestyle intervention entirely lifts nocturnal vascular spasms, shielding your neural framework against sudden thrombus aggregations driving territorial embolic strokes. Movement number 3 incorporates utilizing a structured scalp capillary activation technique via your 10 fingertips. Please click like, subscribe to Boston Community Health, and comment your age below. Interlace your fingers and comb smoothly from your forehead backward toward the occipital zone under moderate pressure. Your scalp tissue houses millions of microscopic capillaries connected indirectly with intracranial circulation networks. This consistent mechanical stimulation heavily accelerates blood velocity, entirely clearing stagnant blood accumulation, protecting cerebral white matter structures, and reversing vascular dementia past age 60. Movement number 4 delivers the advanced palm friction solution, aggressively rubbing both palms together until generating a significant amount of natural, deep thermal energy. The human palm architecture concentrates a dense network of peripheral nerve receptors linked directly with your brain's primary cardiovascular and autonomic regulatory centers. The absolute moment your palms generate heat, instantly press those warm surfaces over your orbital sockets and bilateral temporal regions. This strategic biological reflex intensely stimulates your vagus nerve, prompting the parasympathetic architecture to take dominance, rapidly slowing heart rate while stabilizing systemic arterial pressure profiles. For hypertensive seniors, this represents an exceptional natural safety valve that decompresses severe early morning cerebral vascular spasms, shielding your endothelium from mechanical rupture driving catastrophic hemorrhagic strokes. Movement number 5 shifts the therapeutic target downward toward your lower extremities, the deep mechanical kneading of your calf muscle complexes. Many sedentary seniors frequently allow their lower limbs to fall into states of chronic numbness and cold temperatures. Your lower calf muscles function effectively as the body's second heart architecture. Use both hands to firmly clasp the calf tissue, executing deep squeezing and upward stroking movements from your heel toward the popliteal fossa. This intervention aggressively pumps stagnant venous blood back to the heart, blocking deep vein thrombosis. If venous blood flow inside lower limbs remains stagnant for prolonged periods due to a sedentary lifestyle, the deep clots constructed here can easily detach, travel through systemic circulation pathways into your heart, and launch directly to occlude major cerebral blood vessels. Executing this mechanical cuff clearance for 2 minutes every evening preserves your peripheral vascular networks fluid and rhythmic. This represents a premier natural option, lifting heavy operational workloads from your heart, maintaining clear vessel walls, and eliminating remote stroke risk factors entirely. Movement number 6 finalizes our therapeutic shield, delivering the deep circular friction technique behind your neck gaze zone, isolating the junction between the cranial base and cervical vertebrae. This specific anatomical pathway houses 2 vertebral arteries running parallel upward to join the basilar artery, nourishing your occipital lobe and vital brainstem structures. Interlace your fingers behind your neck, using both palms to apply deep circular compression clockwise. This protocol permanently releases chronic cervical muscle spasms driven by incorrect seating postures. Chronic cervical muscular constriction compressing your vertebral arteries serves as the primary driver for transient ischemic attacks, presenting as persistent headaches, vertigo, and balance loss in older adults. If this specific arterial lumen becomes permanently occluded due to detached atherosclerotic plaque debris, a catastrophic brainstem stroke erupts, instantly destroying your respiratory and cardiovascular centers, driving rapid mortality. Maintaining this neck friction protocol unblocks the critical vascular highway supplying your brainstem, preserving mental clarity and vital life energy across a lifespan. Coordinating these 6 natural massage methods constructs the most comprehensive protective framework, helping individuals past age 40 shield their central nervous system from afar. However, to permanently master your health autonomy, geriatric medicine strongly recommends combining these daily movements with regular comprehensive microvascular screenings inside authorized hospitals. Standard generic medical checkups remain completely blind to these localized threats expanding inside your vessel walls, demanding advanced diagnostic neuroimaging to map out arterial architectures thoroughly. The primary essential diagnostic imaging option involves undergoing an annual duplex carotid ultrasound evaluation behind the neck. This specialized functional test allows clinicians to visually analyze your entire arterial architecture, accurately measure your intimomedial thickness metrics, and identify early atherosclerotic plaques long before they narrow the vessel lumen. This represents a wise medical intervention, helping you actively implement targeted dietary and lifestyle modifications in a timely manner to achieve natural vascular clearance. The second supreme diagnostic neuroimaging option focuses on undergoing structural brain evaluation via high-resolution MRI scans inside authorized hospitals. Vascular complications driven by chronic hypertension frequently trigger deep, silent lacunar infarct events. They unfold completely silently without ever causing acute external symptoms. An MRI film functions effectively as a visual mirror, exposing those tiny white lesions accumulating on your cerebral cortex, helping neurologists accurately locate white matter degradation to implement early life-saving clearance. Comprehending this entire synchronized biological framework regarding circulatory stagnation and chronic hypertension grants you the precise medical roadmap to construct a comprehensive metabolic shield protecting your central nervous system. You no longer need to analyze elevated blood pressure numbers or atherosclerotic plaques with a sense of passive helplessness. Accurate clinical knowledge and today's 6 actionable mechanical massage protocols represent the weapons helping you dominate your health destiny, preserving the non-stick integrity of your vasculature. Please click like, subscribe to Boston Community Health, and comment your favorite movement below. I want to leave you with a profound clinical philosophy of geriatric medicine, the devastating complication you successfully prevent through your intelligence and consistent daily movement will never make dramatic breaking news. The stroke or heart failure pushed back from afar carries no intense resuscitation moments inside an emergency operating room. It remains completely quiet. The beautiful outcome of that wise prevention is just an ordinary morning, where your brain stays sharp, your steps remain steady, and you continue enjoying warm conversations with family. We will consistently remain here to deliver the most authentic, scientific, and evidence-based knowledge throughout your health autonomy journey. Our professional mission is to deliver honest, international geriatric knowledge without fear-mongering, to help you preserve your physical freedom, cognitive mind, and vital life energy across lifespan. Your brain and cardiovascular system remain completely priceless assets, deserving your highest level of wise protection daily through simple daily habits from your dining table, and these microvascular exercises, effectively shattering catastrophic organ failure risks from afar. Within next week's educational series, we will deliver advanced clinical investigations targeting strategies to lock blood glucose stable throughout the night, a core intervention preventing the dawn phenomenon from releasing hormones driving hypertension, vascular spasms, and brain tissue degradation. This represents a highly critical subject, helping you construct your complete metabolic defense network, maintaining your peak intellectual clarity regardless of the passage of chronological time across your lifespan. Always stay sharp, stay highly informed via accurate medical data, and master your own medical destiny. Bring all of today's vital medical insights together. We have thoroughly exposed the destructive impact of peripheral circulatory stagnation and aggressive mechanical shear stress draining your carotid arterial architecture. Implementing our precise 6-step microvascular massage protocol represents the most natural biological option to induce dilation, soothe your endothelial lining, and effectively shatter catastrophic thrombus aggregation risks from afar. Geriatric neurology strongly recommends coordinating these 5 natural home methods systematically, alongside regular comprehensive microvascular screenings inside authorized clinical facilities to permanently master vascular complications. The true diagnostic evaluation does not terminate at generic laboratory tests, demanding advanced diagnostic neuroimaging including a duplex carotid ultrasound and a wide-field brain MRI scan mapping out arterial architectures deep inside your skull, visually analyzing the specific structural vasculature nourishing your neurons. Represents a wise medical intervention, allowing you to proactively implement timely modifications, dynamically, effectively halting severe embolic strokes or widespread heart failure from afar. When chronic hypoglycemia combined with intense early morning hypertension silently ravages your entire systemic endothelial lining across chronologically long years, it heavily accelerates the progressive accumulation of loose, fragile, and unstable atherosclerotic plaques inside your carotid arterial highways behind the neck zone. Plaque developments driven by persistent high sugar and blood pressure usually possess incredibly unstable, easy to rupture cellular structures under the persistent mechanical shear stress driven by morning circulation. The thin fibrous cap covering the buildup can easily tear, causing cholesterol debris to detach and launch directly into cerebral circulation to occlude main arteries, driving territorial brain tissue necrosis. Clinicians define these deep microvascular obstructions as silent lacunar infarct events. They unfold completely silently without ever causing acute external symptoms, causing patients to dangerously neglect them under the false assumption of perfect wellness. In clinical reality, dozens of these tiny white lesions accumulating over your cerebral cortex will severely destroy white matter architecture, fracturing vital neural signaling transmission, heavily accelerating the progression of chronic vascular dementia, ruthlessly stripping away your personal independence past age 60 milestone. An MRI film represents the ultimate diagnostic solution, allowing neurologists to expose all these localized threats, subsequently implementing precise secondary prevention frameworks, perfectly preserving your quality of life across lifespan, to successfully transform today's complex scientific knowledge into a practical protective weapon for your next physical checkup inside the United States medical framework. I want to provide a concise clinical communication protocol consisting of 3 strategic queries to discuss directly with your healthcare provider. You do not need to live under passive anxiety or surrender your biological destiny to an unfeeling automated medical framework. When you confidently present these highly informed academic queries, you force the physician to concentrate on constructing a highly personalized metabolic protection framework tailored precisely for your own physical needs across lifespan. Strategic query number 1 you strictly need to present to your physician is based on my middle-aged physical status and current insulin resistance. What are the exact target blood pressure metrics and optimal hemoglobin A1C thresholds I must maintain during home logging? This crucial query forces the clinical conversation toward establishing a clear biological milestone, completely eliminating vague guesswork, allowing you to accurately evaluate the real-world efficiency of your daily microvascular movements in this 6-step mechanical massage protocol across lifespan. Strategic query number 2 you strictly must discuss during your clinic appointment is given my structural vascular risks driven by chronic hypoglycemia and hypertension. Am I an appropriate candidate to undergo a duplex carotid ultrasound and a wide-field brain MRI scan to evaluate for silent lacunar infarcts? This specific question advances your medical dialogue into advanced diagnostic neuroimaging dimensions, completely exposing and detailing underlying arterial threats expanding deep inside your soul before devastating physical complications erupt and ruthlessly strip away your vital lifespan. Presenting this complete trio of strategic queries demonstrates that you represent a highly informed individual possessing profound wisdom during your personal journey to safeguard your physical freedom and cognitive clarity across lifespan. You may record these 5 natural methods and 3 strategic questions on a physical sheet, or store them inside your phone app to serve as your permanent roadmap. Many dangerously delay behavioral modifications, waiting until catastrophic vascular events strike. The true clinical power to shield your endothelium resides entirely inside your consistent daily discipline over small habits at home. Implement this precise 6-step microvascular massage protocol systematically starting today to successfully preserve the non-stick integrity of your entire systemic circulatory framework, effectively shattering catastrophic organ collapse risks from afar across lifespan. Please click like and subscribe to Boston Community Health right now and leave a comment below about the mechanical massage technique you find most effective. Wishing you continuous health, and see you next time.